What a panel. This is a proud moment for all of us sitting here to celebrate a journey that we have seen in the last 75 years. And each one of you, the Padma doctors, have contributed in making healthcare affordable, and helping India become the destination for not just affordable, but quality healthcare. So thank you so much. And welcome to every panelist sitting here, Dr. Lal, Dr. Gulleria. My first question, I'm going to begin with Dr. Gulleria. So what, as per you, is health for all?
Health for all is holistic health, which includes health irrespective of your socioeconomic status, caste, creed, religion, or the place that you belong to, urban or rural India, where it does not make you spend too much out of your pocket, doesn't lead to a huge out-of-pocket expenditure, and which provides quality care, which is holistic. When I'm talking of holistic, it means it's looking at preventive and curative health, both. And it is also looking at health which could also encompass alternate treatment strategies which are available as part of our Indian heritage.
Got it. Now, after getting this perspective from someone who is a doctor, medical doctor, let me come to you, Dr. Annurag Batra. As someone who's a non-medico, what does healthcare mean to you? How do you think it is important in today's day and age?
I'm not an expert on healthcare. I'm definitely a student of lot of contemporary things that impact us. Healthcare clearly in the last 27, 28 months is bigger focus than it ever was. Dr. Lal, Dr. Gulleria can focus on. But I must say that over the next 2 to 3 years, first, the expenditure on public health has to go up multiple times. The government has been talking about it for a long time. The expenditure on public health needs to grow up multiple times. Second, I want to say that technology is changing healthcare. Telehealth has been around for a long time, but the last 27 months, telehealth became more acceptable, both from the doctor side and the patient side. And there were business models. Third, Amazon in the world, Amazon Care has acquired physical hospital healthcare delivery facilities. That tells you that healthcare is underserved in the US. Clearly, while in India we talk about what we need to do, we have a long way to go, but our healthcare is still world class. And the medical tourism is one manifestation and validation of it. Fourth, I genuinely believe, and I wrote this, I don't write till I really get spiked about something. I've written 1 column this year and 2 columns last year, and I write my editorial note. But last year, when India achieved 1 billion vaccinations, the New York Times or CNN, I'm not sure, I think CNN ran an article, the headline said, India achieves 1 billion vaccinations, but millions go without a first dose. And it really, I got upset and I wrote a 2,500 piece, basically saying that Indian healthcare strengths are not amplified or talked about. Yes, there were things that could have been better during the second onslaught of COVID. There were things that could have been better. But the fact is, our doctors are more humane. Our healthcare delivery providers are more humane. And we did save a lot of lives. I will not go into vaccine. Last point I want to make. I am a PhD doctor, sir. I have permanent damage. I don't have medical knowledge. But I went to an engineering school, then I went to a business school. I got in when the quality control was bad. I'm from the first batch of it. But in IT services, the reason we've been able to build what we built in terms of large companies and large impact is because we made IT education wider. We opened a lot of IT schools, more engineering graduates came out. From the last 2 decades, I've been hearing Dr. Lal on our forums, other Dr. Devi Shetty on our forums, that the number of healthcare practitioners need to go up. The number of healthcare support ecosystem, the technical trained manpower needs up. So if that happens, I think we will be able to build on the work that all these leaders in the healthcare and healers have done. And technology, today AliveCore is a sponsor, there are other sponsors, but technology is working towards predictive healthcare. I think a lot more work needs to be done in that and make it affordable and accessible. I'll stop there, but I just want to say that we have a long way to go in healthcare. I would expect the government to be able to, like it announced Ayushman Bharat and did a lot of work, but there's a lot of work left to be done in healthcare. And I'm sure the next level of intervention from the government in terms of policy, especially in terms of, more medical professionals being allowed, and you understand the dynamics and the play there, will really help the healthcare unlock. Investments is not an issue, but we have to look at healthcare as a service, because if we can't save our people when we have an issue, in spite of the best intent of everyone and the kind of leaders we have, that means we need to look at healthcare as an investment into our human capital and not an ROI for businesses.
Before we move ahead, I'd like also to invite Dr. Vaidya Kutecha to please join us on the dais. Dr. Vaidya Kutecha.
Mr. Narula, this is a manel. This is a male panel. It doesn't look like a panel. It's a manel.
I agree with you. I think please, sir. Dr. Balram Bhargava, sir, my question to you is there a framework that the government has set up for ensuring healthcare that becomes accessible by everyone? And when I'm talking about making it accessible, it is accessible and even affordable.
Yes. First of all, congratulations for organizing this event. It's always aspirational, and people will talk about all the things that are possible. Having said that, I think the Indian healthcare is not glorified enough. In the last 75 years, the work that has been done by Indian healthcare, whether it be generic drugs, whether it be vaccines, whether it be human resources, whether it be training, whether it be medical colleges, postgraduate training, whether it be ASHA workers being honored by the WHO, a lot has been done, but nothing has been glorified in a big way like IT or mobile has been, or Bollywood or cricket has been. I think healthcare needs to be on the forefront and be glorified in a big way. That is point number one. The important thing is that there is a framework for preventive healthcare, promotive healthcare. The current dispensation is trying to bridge the requirements which were mentioned by my previous speaker in terms of the numbers of doctors, numbers of nurses, numbers of medical colleges at a rapid pace. Important to remember that quality has to be maintained. So we are at this moment having 100,000 doctors per year, and mind it, it's about 2.86 lakhs in China. So we're not competing with China, but we need to get our act together if we want heal in India and heal by India. We have about 120,000 health and wellness centers which are there, but and are being set up. 150 is the target. With that pyramid of health and wellness centers, district hospitals, primary hospitals, community health centers, medical colleges, all India institutes, and tertiary care centers, I think that framework is there. The question arises about the budget. Yes, the budget was mentioned. We are reaching a target of about 2.5% healthcare spending, which was about 60,000 crores last year, is now 220,000 crores this year, with mother and child care, water sanitation, and healthcare combined. So it has gone 3 times, but again, mother and child hasn't been included. Water sanitation has been included. So the budget is there. Yet we are very far away from what we are aspiring to be. I do not know whether we want to be a socialist health system or we want to be a mix and match of social and public health system. But the point that has been made that the empathy and I think the human touch is still there, and I think that should be nurtured in every which way. If you look at the budget that is there in the USA, is 19% of a $19 trillion economy, which is bigger than India's economy, is being spent on healthcare. Yet about 60% of the people get healthcare. It's about 10% in UK, 10% in UK, 6% in China. We are 1.5 expanding to 2.5. We are getting the capacity to expand it, but I think that is a gradual process. But I think the train is on the right track and it is moving with speed. And hopefully this will become the central theme of the national agenda, health.
Dr. Lal, they say that change is the only constant, and in the but the change needs to be triggered. You are the one who triggered that change for the diagnostic industry. You are the one who corporatized diagnostics in India. What, according to you, has happened in the 75 years, whether it is technology, whether it is accessibility, in the quality of outcome of the analysis of the diagnostics? How has diagnostics evolved in the last 75 years? What's been the journey?
So thanks for asking me this question. And the first thing which I would like to emphasize is that now medicine has become more evidence-oriented, evidence-based, as compared to, what we used to call gunshot medicine, that if it is a case of fever, you would just, codeine and you give cough syrup and give something else, etc., chloromycin, etc. So the point I'm trying to make is that 70% of your clinical decisions are based on, lab tests. And that has to be recognized by everybody. And therefore, the importance of diagnostics. Having said that, diagnostics have come a very long way. And I would like to emphasize that in 2000, maybe it was 2000 only, it was the pathology labs in India first, which got accredited by NABL, and the hospital's accreditation came 6 years later, not 6 months later. So there is something right which we did in pathology industry, and therefore the results which we tell our patients that you can get the test done from us and so many other laboratories. I saw Mr. Sanjeev Vashishta sitting here from SRL and many more, that our reports will match those of any lab in London or New York or Los Angeles. And this has not happened just because we wished it, because we worked very hard at it. And we brought quality into the lab services in India, which has stood us in good stead. Having said that, there's a lot of, many kilometers to be covered so far. And I'll give you an example now. So now in India, we have about 300,000 labs. And this is, I believe this figure because 20 years back, it was 1 lakh. And this is Indian Express figure, by the way. Now, out of these 3 lakh labs, well, most of them are, not in the organized sector. They are run by people who should not be running labs, whom we call quacks, and we have no control over the quality. So taking a firm step towards doing something about them, I firmly believe that the government of India should now, pay heed to the Central Establishments Act Bill, CEA as we call it. And that defines, who can run a hospital, who can run an IVF center, who can run an ophthalmology clinic, and similarly about labs. So who can run a lab? And as per the Supreme Court order, it's a judgment, each lab report has to be signed by at least an MBBS qualified doctor. So that is point number 1. Point number 2 is that in 3 lakh labs, we have only 7,000 pathologists in India. So obviously, so many of them are being run by whatever means. Let's not go into that. So to get a handle on the quality of these labs, if the Central Establishment or Clinical Establishment Act is implemented, seriously, I can assure you 50% of these labs, will die down. And the other 50% lab, like 150,000 more, Well, then we can get into the act. Right now we have only NABL, who's the accrediting agency. And mind you, the risk of, my friends are working in the government, that private labs are accredited, but not many government labs are accredited. So this has to be a common kind of a playing field. So then, you can have an NABL like an organization like they have in America. It's known as College of American Pathologists. So for example, if I was a pathologist working in America and my, other people, we would be invited to go to a lab, inspect them, give them an accreditation and come back, and we don't get paid at all. They just pay for, going and coming and staying, etc. But so what I'm saying is it is possible. So we can have another or one or two accrediting agencies, and these 150,000 labs which would be left can be accredited in a given frame of time, say 3 years, 5 years, whatever. So I'm quite confident if certain steps like these were taken, the quality of pathology testing would go up, by leaps and bounds in India. I think I'll stop at that.
Thank you so much, Dr. Lal. Dr. Vaidya, apart from healthcare, we have a very strong heritage. And as a part of our heritage, we have medication systems which are age-old. How are these keeping pace in today's day and age? How are they still being maintained as relevant to the patients?
Actually, this is a wonderful question, and I am in Government of India Ministry of Health since 5 years. So in 5 years, I have seen a lot of changes. So for example, since 2014 to 2020, in 7 years, this sector of traditional medicine grew by 6 times. So in 7 years, it grew by 6 times. It itself, is a kind of a testimony how much is the demand. The another thing is that I would like to cite an example which was published in Journal of Internal Research, that we did a kind of impact assessment of Ayush intervention into COVID with the sample size of 1.47 crore. So it's like about 1% of the total population. We found that 89.9% to be precise, people have acknowledged that they have used some or the other Ayush intervention, maybe yoga or maybe any other thing, for the prophylaxis or treatment of COVID. This is another example. So what I'm trying to convey is that there is a huge undercurrent at the ground that we usually don't acknowledge. We don't know. There is huge undercurrent. This is first thing. Second thing is that our health system in India is very unique. It's like pluralistic healthcare delivery system where integrative health or cafeteria approach health is available. So, for example, 26,000 health facilities in India have Ayush co-location doctors available. So it's a huge. And there is a National Ayush Mission and National Health Mission working together for public health delivery. Dr. Balram Bhargava ji mentioned about the evidence-based medicine. Dr. Lal also mentioned about evidence-based medicine. It was, a standard, kind of statement that Ayush system do not have the evidences. But I would like to mention that there is a portal, Ayush research portal, where there are 33,000 publications posted in a searchable format, which are all published into peer-reviewed journals or index journals. So it's not that there are no researches being done. One more thing I want to mention, that first time in the history of the UN, WHO has decided to establish a global center for traditional medicine in India. And why it is special? That it is first of a UN outpost which is being established outside of developed countries. This is in developing country. First time it is happening. So it shows that how much importance is being given to the traditional medicine worldwide, and WHO is also acknowledging that. Before I finish, I would like to cite a couple of examples about evidence-based medicine. That during COVID times, with the help of all ICMR, AIIMS, and other scientists of the country, Ayush sector has initiated more than 160 studies of different designs, right from preclinical to multi-center trials to prophylaxis to observation studies to so many studies. Out of those studies, there are a lot of publications now came out, more than 50 publications. Couple of studies I want to cite. One is about the IU 64. It is just published last month in Journal of Public Health, which is a very high impact factor journal. And it was a study of 65,000 people who have been given IU 64 on home isolation patient as an add-on therapeutics for 3 weeks. They were followed for 3 weeks. And what we found is very interesting, that it was during second wave where 10% of hospitalization were common. That out of whoever got COVID, 10% would go to hospital. So all of those home isolated patients, out of 65,000 patients, only 300 required hospitalization. And out of these 300 also, nobody died. So out of 65,000 patients who have been given additional IU-64, nobody died. So this is one example. Another example is about our work with Delhi Police, where we have given 60,000 odd Delhi Police people as prophylaxis intervention from Ayush. And they were followed. And then it was studied very rigorously with the DSMB onboarded and with the proper review mechanism. It is also published in the same journal. And it says that the Delhi police personnel have less mortality, less infection rate as compared to the Delhi population or the police personnel of the rest of the country. So those are the examples that Ayush has a lot of potential. What our country needs is that we need to look at this possibility is not only providing our country people the better solution of integrative healthcare, but providing the benchmark model for the rest of the world and also convert it into commerce, because at least 35 to 40% people who is coming to our country for medical travel is for the Ayush. So that's a huge potential. Thank you.
Got it. Thank you so much, sir. Let me come to you, Mr. Girish Krishnamurthy. We have seen diagnostics, we've learned about the traditional medicine and the role it is playing, but health for all cannot be complete if the technology is not keeping pace with the times. What is your view on how and what role the technology is playing?
Thank you. See, let me put in a perspective that how technology can come for a major enabler for health for all. See, we spoke about number of doctors, number of nurses, number of hospitals, infrastructure, clinic. It's all necessary. But in India, we kind of say for every 1,800 people, we have one doctor. But if you just go on demystify that number, you will get an answer. It is 1:1,800 probably in Delhi or Mumbai or Chennai or some of the big cities in the country. As you start moving a little far to the rural India, it increases by many-fold. So this is the first problem we have in terms of availability and access. Now, if you go a little further and start dissecting that by specialization, for example, mental health, maybe it will change into 1:5 lakhs. So this is the kind of challenge we have. Now, if you look at it in a manner to create infrastructure, process, human resources, it's going to take a long time, no matter whatever. And even if you increase the 2.5% to 10%, still you cannot achieve it. It is not a question of money. It's a question of multiple things you have to do at the simultaneous. Now, we did an experiment. I'll just give you how technology can play a role on an important point. In oncology alone, we did an experiment of following about 1,800 oncologists in the country and look at what they do and where they spend time. About 52% of the time they spend in non-clinical activity. Be it AIIMS, be it in regional cancer center, or be it in a private hospital, wherever you go, the health science processes has developed over a period of 100 years and developed predominantly the protocol, care pathways, methodologies, everything from the health science perspective, predominantly driven from the Western world. So it has gone into a scenario where it is really. So now that 52% or about 35% of the time they spend only on administrative activity. If you just take and if you give the job to somebody else and use the technology for it, then you unleash a huge amount of value out of this. This model we call as, we developed this. Fortunately, we had an opportunity to work in All India Institute of Medical Science, and we worked in several large hospitals in the country and several public health systems at a district level. And when we experimented this, we came up with this model to create a bridge, digital bridge between the access and the demand, which has shown a phenomenal result. So my view is that technology today, last 25, 30 years, if you look at it in healthcare specific, the technology and an innovation came into healthcare, which always assumes when a patient is with a doctor. A patient is with a doctor in a clinic or in a ward or in a procedure room or in an operation theater. But if you take a patient who is admitted in a tertiary care hospital, how many minutes or how many hours a doctor spends time with? But the majority of activity is how to, 2/3 of the world struggles how to get a patient to the right facility, to a right doctor. So the technology intervention in that area creates a significant role. And the way we unleash the capacity and look at the processes which is required, of course, we make an assumption by just bringing a telemedicine healthcare is technology. Bringing a doctor in a video call cannot be a new technology, which is there forever. And if this problem can be solved, we would have solved it. And then we talk about data in technology. We make an assumption like any other industry, whether it's a banking, financial services, retail. We make an assumption if you bring data together like any other industry in a cloud platform or together, then we solve the healthcare problem. But healthcare is a very, very different. It's a very context sensitive. 5 minutes before your BP is no longer valid. So you got to be very careful what data you present. And Dr. Lal mentioned about, evidence-based. Now the evidence-based today, for everything we create evidence, but the whole evidence isn't disparate. And it is all available in a different format. So the technology to bring together these evidences plays a very important role. And healthcare is one area where the data, which is highly unstructured, doctor communicating a patient, writing a prescription, and for the same disease, same prognosis, same diagnosis, there are multiple different methods to treat, multiple way of thinking through. Now, all of this to bring it in a standardized model where the technology comes to play a role. And I believe it is a very fortunate scenario. India is in a stage where we are a leader in technology and we have the biggest problem of healthcare. And third is we wanted to do it smartly with always like how we did in aerospace and other areas. We also have a smart people like several of our health physicians and doctors we can figure it out to efficiently build an health system. And technology is going to play a pivotal role. By using technology, I'm very, very optimistic. 10 years from now, probably our healthcare is the best we can deliver because all of us know Western world and other of them are terribly failed in delivering healthcare for all. So the health for all with the technology is the mantra I feel will happen in the next 10 years.
Thank you so much, Mr. Girish Krishnamurthy. We've faced a lot of challenges in healthcare over a period of time. There are various challenges in terms of the diseases and the conditions that you've gone through. So my next question to you is, Dr. Ravi Shankar, TB has been a huge burden on the Indian healthcare system. How well are we poised to eradicate TB, and what could be the role of public-private partnership in this?
So if you look at infectious disease, not just tuberculosis, if you have to eradicate any infectious disease, 3 things are important. 1, diagnosis. We have to diagnose the disease. We have to screen the patients, ensure the diagnosis is appropriate. Secondly, we have to ensure that the patients who are infected are treated well so that they don't spread the disease to others. And the third part is prevention. Only if you have effective preventive strategy, we'll be able to eradicate a disease. We have not seen any disease, any infectious disease which have been eradicated without an effective preventive strategy. Now, if you look at how are we poised towards this, in the recent past, a lot of progress has happened. So let's go by step in terms of diagnosis. Now, if you look at tuberculosis as an example, microscopy and chest X-ray plays a pivotal role in screening and initial diagnosis of TB. Now, there are X-ray machines available, even in the periphery in India. The problem was radiologists. We did not have radiologists to screen through these X-ray films and help in diagnosis of tuberculosis, or to stage to see the severity of the tuberculosis. Now there are AI applications available. Now we have a digital X-ray, we put in the machine, now AI tools will compare against the background X-ray films and then let us know the diagnosis. Even in automations are bringing in microscopy as well. So there are automations to have a smear in place, to look at acid phosphacilli through AI intelligence. Now in terms of confirmatory and even in resistance testing, now in recent past, there are molecular diagnostic tests that are available even in the remote places. So a physician can do not only the confirmatory test, but also know the resistance pattern and treat the patients appropriately. In terms of treatment, a lot have changed in the last 5 years. Now we have oral drugs available even to manage drug-resistant tuberculosis, whether it is multi-drug resistant tuberculosis or extensively drug-resistant tuberculosis. What used to be an 18 to 24-month treatment with injectable with so much of toxicity, now we are able to manage these patients with 6 to 9 months of oral treatment. So we are bringing down considerably the duration of treatment, and we are making regimen more simpler without injectables, more safer. So it is helping physicians to manage these patients better. And cure rates have gone up multifold with these newer drugs that have been launched. Now, there is also a robust prevention strategies that are in place for the close contacts. So close contact screening is happening, and now close contacts are also being managed very well. Now, with this, I would say that we are progressing very well, and definitely we should be nearing the eradication very soon. In terms of public-private partnership, this has been going on very well in tuberculosis since last many years. Now let's go with again diagnosis treatment pattern. In diagnosis, many organizations, including us, have been very closely working with program to build the capacity or on-ground presence to boost diagnosis, whether it is door-to-door screening with risk questionnaire, identifying the risk population, and sending the samples for screening, identification of the disease. Those who are diagnosed, linking them to care, which is most important, and making the patient aware about the disease is also important. So patient education comes into picture. And this is what a private partner can very well do along with the collaboration with the government. Educating the patients, making them understand about the disease, what happens if they don't take the treatment, and also ensure that they go back to the center once in a month to collect the tablets, ensure that the compliance is maintained. The other part is healthcare providers. The constant upgradation is needed because, again, TB is evolving. The treatment paradigm is changing. So how can we build the capability within the doctors in the periphery to manage disease also play a role? If you look at the treatment part, now the newer drugs have been made available in a controlled setting for the right reasons because of resistance. Now here again, private and government hospitals can come together. A center of excellence can be created in the private hospitals, and the private hospitals can also start treating these XDR TB with these newer novel drugs that are available for managing the disease. Lastly, in terms of innovation, again, government and private can come together very well, and it's happening very well, whether in terms of developing homegrown technologies that we are seeing in TB. There are many homegrown solutions that are out there, or bringing in technology transfer from the global organizations to India and creating India as a hub for Make in India would definitely help in scaling to our needs and meet our strategic goal of achieving eradication of tuberculosis.
Thank you so much. Dr. Anoop Misra, thank you so much for joining us. Dr. Misra, prevention is the new buzzword. And especially after pandemic, we've seen that, people are a little conscious and mindful, and they're taking care of the body in a preventive manner. The second thing is personalized healthcare. What do you think where we are headed and how are we making this a reality?
Thank you. I apologize for joining late. Since I was an ordinary student of medical sciences and now in the corporate sector, one thing I've understood very well, wherever we are reaching as far as the non-communicable diseases is concerned, whether it's diabetes, whether it's hypertension, coronary artery disease, non-alcoholic fatty liver disease, and things like that. Everywhere begins long time back. It is not something which has grown overnight. And so something which begins in the teen years or maybe early 20s. And we have done a number of studies regarding this in the schools, and we published widely. And the watershed period where it begins is around 10 years of age, and then subsequently. So we have to prevent these things from happening right from that time on. So prevention starts in the childhood, actually. It's not a adulthood. By the time the thing's already in motion, and we'll have so much more difficulty in reversing that juggernaut which has started back into the normalized state. So that's what we have been saying, that we must concentrate on school children. We must concentrate on their nutrition, their habits. By the time they are 14 or 15, the habits are well set. So just a couple of years and they are well set into the non-communicable diseases. And we have seen and we have published that around 20 are the lipids, the triglyceride and HDL cholesterol start to go wrong around 20 years. That's a forewarning that things are going to go wrong. And then subsequently blood pressure and sugars in 25 and 30. We are seeing a patient with type 2 diabetes in the teenage years now nowadays. So our money should lie in the prevention in the schools, and the government of India, I was part of it, started a program for the school children, and I think it's going on, but I think we need much more vigor and much more force to force that change, which is as yet not happening. The second part of that is the primary health centers, because the moment a person becomes ill, he comes to the primary health center in the villages, in the rural areas, and there's where, again, the prevention lies. The primary health center or mohalla clinics or these initial clinics. That's where we have a problem with the resources also, because we don't have much of a resources, people who are trained into nutrition and so on. As far as personalized nutrition and personalized health is concerned, that comes much later. And things have been set in motion, and I have a certain disease, I want to reverse it. Then I go for a personalized nutrition program, a low-calorie diet, a high-intensity exercise program, maybe some drug. And that's where the work of a doctor and nutrition comes in. But before that is the work of the public health specialist. I think public health specialists should be the backbone for prevention of non-communicable diseases in India.
Thank you so much, sir. So we've touched upon diagnostics, we've touched upon healthcare, technology, government policies, and traditional medicine. But healthcare cannot become a reality until and unless we have awareness that is created. Dr. Batra, I would like to ask you that what is the role of responsible media that plays an impactful role in creating a better aware society that leads to a healthier nation?
First of all, I'll answer that and I'll give a specific answer. That's an area I have some understanding. But I want to ask Mr. Lal, I was reading this book by Anthony Robbins called Life Force. And he has interviewed the world's top 22, according to him, scientists, thought leaders, practitioners. He primarily is talking to them about longevity of life, reversal of diseases, fixing of diseases, genome surgery. He and Peter Diamandis have done it. And he alludes to in one of the chapters, I don't remember, that tomorrow there is no need for blood to be drawn to. Tomorrow doesn't mean like 10 years from, in the very near future. For blood to be drawn to be able to diagnose what the medical issue is. What are you're an entrepreneur, of course, you're a healthcare leader. But what are people like you thinking about the future where there's no blood being drawn out of a human being to be able to predict? And 10 years back, there was a company called Theranos, which turned out to be such a hoax. Not only a hoax, it turned out to be a fraud. So clearly she was working towards affordable. So what is your prediction in terms of when will it happen in India where we don't have to put something in the body to be able to take out blood and predict?
So, thank you, Mr. Batra. It's a slightly complex question. So to answer your question head on, even today, Dr. Anoop, Misra, Dr. Gulleria would know that we have got sensors which can be put inside the body. They are monitoring blood sugar and also releasing insulin as and when, the blood sugar goes up and down. So that's one. Now, as far as Theranos is concerned, this was, a company, for those people who have not heard, that this was started by a 19-year-old dropout of Stanford University by the name of Elizabeth Holmes, who claimed that she would, from a drop of blood, she would be able to carry out practically all the tests which we carry out. So cutting a long story short, it turned out to be a hoax. She tried her level best, and there is a court case against her, etc., etc. So testing without blood, I can tell you that I've read reports that in MIT-based medical doctor had perfected a hemoglobin testing device which could take the hemoglobin without puncturing the skin. So right from, like you put for a biometric analysis, you just put it and the hemoglobin could be done. And this, he said, he invented it because his mother was a gynecologist, and during pregnancy, the lady's hemoglobin would sometimes come down to 2 grams, which would unrecordable kind of a thing. So that is how, but it was not found to be, very practical, because if you have, very cold climate, you have very hot climate, you have perspiration, etc. So these things don't work. What I'm trying to tell you, that blood testing and the labs are going to be there for some time. So that I can tell you very confidently. But having said that, I think the time has come for us. The labs are getting smaller and smaller. Now, lab on a chip is a concept which has been talked about. There are people working in India also, but we haven't seen really one in which, you can put a lab in your pocket and go to the rural area and put a drop of blood. Well, for those of you who are scientifically oriented, there's going to be a microprocessor there. There's going to be fluidics. There will be pumps, nanotechnology, and God knows what all, I'm missing, magnetic something, etc., etc. So these things are being worked upon, and I look forward to the time when people like us, we have 5,000 collection centers. I can turn each one of those collection centers into a lab. If I have a lab on a chip, in my pocket. But that will have to wait. So right now, what I'm saying is that this is a time for the government and the private sector to come together. And we have 2 stalwarts here, which I'm proud to say I'm sitting with them. One is Dr. Balram Bhargava, and he was the first one who called us at the time of COVID. He said, Dr. Lal, you please come and bring your friends along, and let's start, involving the private sector. And do you know what we have done? 2,300 RT-PCR labs are running in India, out of which 60% are private labs. Thanks to Dr. Bhargava. Please give him a big hand. And the second person whom I'm delighted to be in this August company is, Vaidji, Dr. Rajesh Kutecha, who is the Secretary of Ayush. You have no idea how we have worked together. I am an allopathic doctor, but having an interest in ancient medicine. And he just came up. I belong to an ashram. I run an Ayurvedic hospital. In fact, I run 2 Ayurvedic hospitals in Uttarakhand, and Dr. Kutecha has been to both of them. So what we did, I said, Dr. Kutecha, we'd like to come into primary healthcare. My wife and I, we have a, kind of an organization, philanthropic, and we would like to, work with the government of India. So he says, Dr. Lal, come and take as many health and wellness centers as you can. So because we were just starting, and they said that don't try to jump, take baby steps. So we took 3 health and wellness centers in Uttarakhand from Dr. Kutecha and 7 from the NHM. And guess what? After 1 year, we are showing the results. So what we said was, our commitment to society was that these are HWCs. I'm not trying to teach the government how to run HWCs. Point number one. I'm only there to see if I can be of any help. If there is a gap in something, I can, put into that gap, I can put something there. And we have turned it around. 10 health centers are running with this thing, including, I never wanted to get into pathology in Uttarakhand. But when we went there, we saw, which is again approved by ICMR, there is a national list of essential diagnostics, which was ratified by, given by WHO, and ICMR is ratified. And when we went on the ground there, we saw that even for glucose testing, things were not available. They said that they can do it by glucometer. I said, show me the glucometer. And they said, Dr. Lal, we have the glucometer, but we are given 25 strips to test in 1 year. So that is the ground reality. And that is where Dr. Kotecha and I, we are working together. And I think if we are given more chances like this, we can turn it around.
Thank you. Please give all the leaders a big round of applause. And just to answer your question, Harbinder, I must say that one, I don't think overall media sometimes, before I got into Businessworld, I did build Exchange for Media, which is India's #1 medium on the business media. So I have a locus standi to be able to come. I don't think we take up serious issues sometimes. After the last 27 months, if healthcare is not the most important issue, I don't think, what a certain actress is wearing when she stepped out of the airport gets more views than Dr. Mittal possibly giving a playbook for a healthy preventive lifestyle. So I think media has to continuously, even when we are not in a pandemic, hopefully we are post-pandemic or in a milder pandemic, whichever way you want to look at it, we have to consciously devote more time to one, as Dr. Bhargava said, bringing the strengths of the Indian healthcare system to the fore. I wrote that piece and I'll share it. I don't think we do that. Second, as he talked, we have to talk about in the media about 4 other things which are related to healthcare, which we don't. Nutrition. And I eat more, but we have to talk of malnutrition, which is still, we have to talk of 100. Air quality. Agle 2 mahina, we will again talk, because it's that time of the year when the crops are burnt in Punjab and the quality of our air then leads to a lot of other things. We have to talk about the quality of the air till it is solved. We don't in the media. Third, I don't think, as he rightly said, we celebrate our leaders in the healthcare, whether they are policymakers like Mr. Vaidya or Mr. Bhargava, or people who ran institutions and provided leadership. We don't. We have to bring their stories and constantly kind of bring them upward. And last but not the least, successive governments have talked about healthcare and done a bit. I mean, we have a robust healthcare system. So clearly governments have done their bit to say they haven't. But I think we have to do a lot of catching up and really put our policies into execution mode. He gave some examples. When I was thinking, I was listening intently to everyone. What has changed now that the implementation will happen to the scale of all of these people represent? Possibly there is a bigger political will. Possibly we have a chip on our shoulder. We want to showcase to the world and to ourselves that we are better than you in every aspect. Possibly that will make it happen. But I think if India has to become what it wants to become in terms of economic terms, it is a good decision to up the case on healthcare. It is a good economic decision. It is a good human decision. And that's why it will happen in the next few months. That's what I get a sense talking to policymakers in the government. And I think the policymakers in the government are also much less celebrated, or at least patted on the back than they should be. I mean, look at, we did the number of, I don't know what is the number of vaccinations today, but we've done 2 billion plus. 2 billion plus vaccinations. I mean, we've saved how many lives? So clearly, I think we do not talk about, I keep saying in every index, either doing business, maybe there is a healthcare index. The way these indices are done by World Bank and global authorities, they do not play to India's strength. So we have to stop only believing these indices and these rankings. We have to in some way come up with our own, whatever. And I'm not saying just doing chest pumping, improve, whatever. But I don't think the global media does justice to India's prowess and contribution in healthcare, especially when we have 20% of the world population in India. So I don't think we do get a fair press from global media. And in Indian media, generally, unfortunately, we don't focus on serious issues like environment, like healthcare, like nutrition, like mental health. Mental health was a flavor when the pandemic was there. These days, we don't talk about mental health. So I hope things change because we have a chip on our shoulder and we also believe it is linked to our growth.
No, I completely resonate with what you're saying because if you look at it, I mean, the study of genomics, etc., it has been proven that every geographic location has a set of population which has got different sets of problems. Dr. Bhargava, I have one question for you. Primary healthcare has always been a priority for our government. Sometimes it was very difficult to bridge the gap that existed. We still have large hospitals who are trying to fill the beds, and in rural areas, we do not have healthcare available. Do you think that the technology development that has taken place today is bridging this gap to bring healthcare to the rural segment beyond just video consultations?
I think that's a very important point that you have made, and you've hit the nail on the head, that there are hospitals which are trying to fill up their beds in the tertiary care centers, and the primary health is still being neglected in a big way. Yes, technology can play a role. The work has gone down from the specialist to the generalist to the nurse provider to the ASHA, and it has gone down to that level in the sense that the ASHA workers have become the backbone of the primary health centers. And they can use technology, but technology sometimes over-promises and under-delivers. So we have to be very careful when we use technology. It is a double-edged sword. So what I think when we're going to the primary health centers for telemedicine, consultations, diagnostics, technology will play an important role. But the mindset of the people also has to change clearly, that medicine is not like engineering, or biology is a stochastic science. It is not a deterministic science. The example with Girish has talked about space and nuclear and testing regularly, the Six Sigma of Motorola, that does not apply to the human body. Over testing and creating over paranoia has to be carefully balanced. So that is an important point. So overuse of technology, right use of technology is what is important. Overuse can mess it up, but I think a lot of promise.
I've just been informed that the Honorable Minister should be here in the next 5 minutes. So I think we'll have to wrap it up. But before I let go, Dr. Gulleria, I just need in 1 minute, if you can share that how the mindsets of the care receivers has changed after pandemic. I mean, all of us had teleconsultations always available, but nobody was using it. But today, has the acceptance changed? Very briefly, sir.
So it has changed. I think the receiver has, two things have happened. One is the focus on preventive health has become much more than what it was before. People have started realizing how important it is to stay healthy. So getting regular checkups done and early diagnosis of non-communicable diseases has really picked up. And like you said, using teleconsultation and other means has also become something which has been looked at. And I think that is the future, and we should be able to have it, but it has to be user-friendly.
Thank you so much, everyone. for joining us for today's session. We have our chief guest here, so I think we'll wrap it up here. Thank you so much.